wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, a pharmacist and physician liaison with Physicians Preference Pharmacy, and I am joined by Elena Mango. And today we are going to talk about Amlexanox, which is a compound that we've added to our formulary several months ago now. It has a lot of really interesting indications, and it's a product that not a lot of people have heard about, right?
Right.
So we're going to kind of pull apart the whereabouts of Amlexanox, who it can be used in, and perhaps you can see if you think that you might be a good fit as far as some of the symptoms that we talk about as well. So
Perfect.
We got some questions?
We sure do.
All right.
And as always, we're going to start from the top. So let's tell everyone what Amlexanox is.
Yes. Well, Amlexanox first is everyone's favorite thing to pronounce, right?
That's right.
So,
exactly.
Amlexanox. So Amlexanox it's an interesting compound that has an older history. We like to always utilize products that have been in our wheelhouse for a long time. Sometimes we end up using them for different purposes than they were initially intended for. Mm-hmm. And Amlexanox is one of those. So Amlexanox used to be branded actually as an oral paste to be used inside the mouth. It was called Apthosol. And Apthosol, like the name suggests, was used for aphthous ulcers, which are these little ulcers that form inside the mouth and have they breach that barrier. So they create this opening, which makes someone at risk for secondary infection. Mm-hmm. So this paste, Apthosol, could be placed over those aphthous ulcers and heal them. And one of the reasons why is because Amlexanox, the compound in Apthosol, is anti-inflammatory. It also helps to address allergic type reactions. And so it used to be used as the paste, but it fell out of favor in the U.S. market. Now, it's still being used in other countries widely, not so much as the paste, but actually for allergy treatment, Japan being one of those countries that it's still used in. So even though other products came on the market for oral paste, Amlexanox never was repatented. So it is only available as a compounded product. So only at compounding pharmacies. And I actually don't know of other compounding pharmacies that make it. I'm sure they're out there. So we have a lot of guests that come to us from all over the country that utilize our compounded Amlexanox, which we make in oral capsule form.
Okay. And so when guests come to Physicians Preference Pharmacy for Amlexanox, what are they coming for? What are you treating them with for symptoms?
When I think about the guests that would fit in a good bucket for treatment with Amlexanox, we're usually thinking of the treatment refractory guest. And what I mean by that is they've tried everything, but certain things just haven't worked for them. Or some things have worked mildly for them, but have not given them full resolution. So with Amlexanox, a lot of people will call it a miracle compound. And I think the reason that they think that is it helps with so many things. Mm-hmm. Of course, we love products that cast their net very broadly so that we can accomplish a lot of things with just one product. And Amlexanox is one of those products. So when we think of chronic conditions, when we think of inflammatory conditions, when we think of conditions where the immune system is out of balance, those people are good candidates for Amlexanox because it works as an anti-inflammatory, it works as an anti-allergic type compound, and it also helps to modulate the immune system or bring it back into balance. Mm-hmm. So one of the interesting things pharmacologically is that the chemical structure of Amlexanox is very similar to that of some other products that are currently being used as anti-allergy products on the market now, like Cromolyn, Gastrocrom, Nasocrom, and some of those products that decrease the histamine response, which causes a lot of inflammation in the body. Mm-hmm. So when we think of autoimmune conditions, we think of fibrotic conditions or inflammatory-driven issues in the cardiovascular system. When we think about eczema and psoriasis and even things that are going on the skin.
Topically.
Yes, a lot of times we can address that by treating it topically, but it doesn't really address the root cause or the root issue of what's going on, which oftentimes when something presents itself on the skin, like eczema or psoriasis, it is an outward manifestation of a dysregulated immune system, typically at what we call the T helper cell level. So those are part of the immune system. When those get out of balance, we get flares on the skin. When those get out of balance, then our immune system starts it goes into attack mode on the body and causes more and more and more inflammation. Also, we have a lot of guests that come to us that have chronically been on steroid treatment, and they have a hard time tapering down. Amlexanox can be helpful to kind of bridge them off of that therapy and give them a reduction in inflammation.
So to wean them off, would they ever get off of the
Exactly.
steroids completely by using Amlexanox?
They can. They can. We usually find that when people get down to around 10, 20 milligrams of steroids, that it's a little bit hard to pull them off completely until the root cause is addressed, though.
Okay. And you said that the Amlexanox comes in capsules?
Yes.
So the capsules will treat an autoimmune disease or inflammation or allergies internally, but anything also topically on the skin.
Yes. So we do have a lot of guests that do use it for both eczema and psoriasis.
So what would you say specifically some of the benefits of Amlexanox could be?
Well, the main one is a reduction in inflammation. And that happens in a variety of different ways. One pathway that we have to talk about when we talk about Amlexanox is the mTOR pathway or the target. It's a place where certain compounds can bind and change the function of the body. So what I mean is this mTOR pathway, which stands for the mechanistic target of rapamycin, which is also where rapamycin binds, another one of our favorite drugs, is we get something called cellular autophagy when we start working on that mTOR pathway. And cellular autophagy is cellular housekeeping. So just like you have to clean your house, on a daily or weekly basis or however often that is, our body has to do the same thing. Our cells have to do the same thing. And when it doesn't do that appropriately, that's when our cells get junky, we get toxic, we get that toxic buildup, and then we start having a buildup of inflammation in the body. So Amlexanox, by inhibiting or working on this mTOR pathway, helps to decrease inflammation, improve cellular autophagy or cellular cleanup. It also helps to some extent mimic intermittent fasting. So that sensation of caloric restriction for the body is really good for longevity of the cells and how long those cells last, or rather than killing themselves off because they're not healthy cells. We want to keep our cells around, but only if they're in a healthy state. So first and foremost, inflammation is our biggest reason for using it.
And so that sounds a little bit similar to rapamycin because that also mimics fasting. Would someone take Amlexanox and rapamycin together?
They absolutely can. It's pretty hard in today's world to overdo mTOR inhibition. So that pathway that we want to inhibit, just like anything, you don't always want to inhibit or always stimulate. You have to have a balance. But someone would really have to be doing a lot of things, taking a lot of medications, a lot of supplements, doing the lifestyle changes, physically intermittent fasting or fasting for days on end, being in the gym all the time to really overdo their mTOR inhibition. So it's pretty hard to get yourself into a state like that. It's not impossible, but it's pretty hard to do.
Right. Okay. All right. So talk to me a little bit about some of the things that I know patients are coming to you about, and can Amlexanox help that as well? So things like long haul and longevity and asthma, I'm thinking about that histamine response. What are some of the actual conditions that people would want to use Amlexanox for?
Some that come top of mind, which are probably the most pronounced, are asthma and allergies. And so just to unpack that for a moment, we can't talk about Amlexanox without talking about how it stabilizes the mast cell, one of my favorite cells I love to talk about, which is a very crucial part of the immune system. The mast cell is a type of white blood cell, which has a lot of implications in the body. but one is addressing inflammation. So we want our body to experience inflammation, but only acutely or only for a short amount of time. When the inflammation is chronic or the response is uncontrolled, that's what an allergy looks like. That's what asthma looks like, because you're not just reacting to something, let's say in the environment, as a mild allergy, something that you're constantly responding to, causing a lot of inflammation in the lungs and throughout the body, causing more of a chronic issue. So those mast cells are designed to help screen everything that we come in contact with to see if it's safe or not. And if the body or the mast cell perceives that as a foreign body or something we shouldn't be ingesting or getting exposed to, it goes, whoa, that is not good. That is not safe. I'm going to create a reaction. Part of that reaction is histamine release or the histamine response. Again, histamine is really important. We have to have it. It's good for keeping the blood vessels open, improving circulation. It helps to balance our mood and do a lot of really great things. But again, if there's too much histamine release, what happens? Then it's neuroexcitatory. Then our mood gets imbalanced. We can't sleep. All of these signs of dysregulation. So if we can help to balance the mast cell and calm the mast cell down, like Amlexanox can help us do, then we're calming that inflammatory reaction that happens in the lungs. It also helps to stop bronchospasms. So these vibrations or spasms that happen in the lung tissue, it can help to calm down that reaction so that people don't become so or remain so reliant on their inhalers, for example. So we do have guests that have been very reliant on several inhalers, maintenance and rescue inhalers, that after starting Amlexanox, they're able to come off of those.
That's incredible.
Which is really incredible because not only do you not want to have repeated exposure to that, but inhalers are expensive.
Yes.
They're very expensive.
Right.
Food allergies is another big one. Also helping to get hemoglobin A1C into range. So if you think about the type 2 diabetic patient where there's some dysregulation in insulin and how the body pulls up nutrients, and also blood sugar dysregulation, Amlexanox can help pull that back into that favorable range, which is great, again, because when we do that, we can help pull these people off of other drugs.
It's amazing. Sounds like it's really terrific. So we talked about some of the common things. I want to bring up a few things that I've read. Can you talk to us about erectile dysfunction, something that people might not think that this could help with?
Right. And so the reason it helps with that is it improves circulation. It also improves blood pressure. So it will work on the walls of the vessels and address what we call PDE5. PDE5 is the target for a lot of drugs that are used for erectile dysfunction. And so Amlexanox will also bind there and help to get the blood flowing where we want to go when we want it to go there, which is really important because the thing about erectile dysfunction is it usually can be two primary things. Either one, it's a libido issue. So the stimulation isn't kind of making the connection with the brain to maintain an erection. And the second thing is it can actually be mechanical, which we actually see that a lot in type 2 diabetes, is because there's poor blood flow. It's not getting to where it needs to go to get and maintain an erection. So if we can address that part.
And that's the whole circulation piece.
Exactly. It's a circulation piece. The mechanical issue, then we can rectify that.
Okay. That's really interesting to know. Okay. And then I've also seen cardiovascular disease, long haul syndrome, which I mentioned a little bit earlier, and then also obesity.
Yeah. So the obesity component is partially that mimicking of intermittent fasting. And the other part is the regulation of blood sugar. So bringing that back into a normal range can help to stop some of the vacillations in blood sugar or those peaks and crashes that we get after a meal that cause us to then crave more and more unhealthy foods. So with that mimicking of intermittent fasting, the correction of blood sugar, it helps in the overweight population. With long COVID patients, what we typically find is because of the mast cell overactivation component, they get some relief of the brain fog. So that brain fog, or COVID brain, as a lot of people will refer to it, is almost a direct impact of mast cells being overactivated for a very long time. So now you've got this exacerbated inflammation going on in the brain tissue, which causes that very foggy thinking that people have, trouble with word recall, just that haziness that kind of looms over people all day long.
So many people
A lot of people experience that. So when those mast cells are calmed down, then the brain fog will lift.
Okay. And then the cardiovascular, it's all connecting, right, with the circulation.
Yeah, it's all connecting. Yeah. When it works in the walls of the vessels like that to stabilize the walls of the vessels, it will help to promote more healthy and consistent blood flow to all the tissues.
Okay, great. And the last thing that I wanted you to touch on was non-alcoholic fatty liver disease, because we're seeing a lot more of that in the recent years. Liver enzymes, in blood tests are going way high. So let's just talk about that for a minute.
So within the cardiovascular system and all the different organs that it connects, we also talk about the walls of the vessels. And when there's injury to the walls of the vessels, then the body comes down and lays down a network, usually of cholesterol first, and then plaque can build up. And that in itself is not the issue. That's actually a protective mechanism by the body to help protect it from further inflammation. But we can get ourselves into this fibrotic state, too much fibrosis or fibrotic tissue buildup in the organs, in the vessels, which is partially what's happening in the non-alcoholic fatty liver disease, which is their liver disease is not attributed to alcohol consumption. It's a fibrotic state. And so Amlexanox helps to decrease that pro-fibrotic mechanism. So rather than being pro-fibrotic or creating fibrosis, it's almost anti-fibrotic.
Wow. Sounds like Amlexanox is a miracle compounded medication.
You see why people think
There's
that.
so many symptoms that it can help. It just it's really a great education. There's one last one. I thought that was the last one, but genetic diseases. Can you just touch on that?
So, boy, that's a complex one that we could talk about all day, right? Because there's so many factors that play into why people have different types of genetic expression. The genes that we are born with are the genes that we die with, but what happens in between is what changes how we feel or the symptoms that we show up with. So if we take cystic fibrosis, for example, and that has a genetic component to it where there is a shift or a change in the DNA that is not favorable, that causes a lot of issues that show up in cystic fibrosis. Now, although the research might be a little bit young, it's compelling in the fact that Amlexanox can actually change how the DNA is behaving. So that rather than that piece of DNA misbehaving so that we have symptoms in alignment with cystic fibrosis, it actually changes the expression so that you no longer have those symptoms of cystic fibrosis. So for something to actually interject itself in the DNA like that is a unique component. We don't see that with a lot of drugs. They're few and far between.
Yeah, so interesting. So how does one know if they can benefit? There's such a plethora of symptoms that it can help. So how would a patient know that Amlexanox can help them?
What I would say is if you've had long withstanding inflammation, chronic inflammation, or an autoimmune condition, and you've tried a lot of different things and they haven't gotten you to where you need to go, I would definitely consider discussing Amlexanox with your physician, because sometimes when we have a chronic condition, yes, it might be a culmination of a lot of different things going on, but until we find that specific point in the cycle where we can interject and break the cycle, nothing else will fall into place. I don't think we talk about that enough.
Makes sense.
I think we just think, oh, well, if we treat each individual piece, then certainly everything should rectify. But I don't fully believe that. I think that we get into a holding pattern a lot of times. And actually, we see that a lot with mast cell activation patients, a lot, which causes a lot of the frustration. And one of the reasons why a lot of physicians have no idea where to start with these patients. So we have to interject somewhere, usually by stopping the inflammatory cycle in some way first. Once you take the inflammatory burden off of the body goes, oh, finally, I can just focus on healing now. So if you've got something that's inflammatory driven or chronic, treatment refractory, definitely at least think about adding Amlexanox to your arsenal.
Okay. And how would someone go about that? So they would talk to their provider. Their provider they need a prescription. And
yes, prescription only. So just like anything we offer at Physicians Preference Pharmacy, because it's compounded, does require a patient-specific prescription.
Okay.
Talk to your physician about prescribing Amlexanox. Chances are they're not going to know what Amlexanox is or how to say it. So they can call us, and any of our pharmacists can walk them through that, because we have a few different doses available. We dose it differently throughout the day depending on what we're trying to address. So just have the physician call us, or you can call us with any questions that you have. But reaching out to us at the pharmacy, you can get a hold of us at 281-828-9088, or also go to physicianspreferencerx.com.
Okay. Well, thank you so much. As always, it's such an education, Bryana, and I'm sure people will be very grateful to learn more about Amlexanox.
Thank you, Lena. I appreciate you.
Thank you.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.